I shouldn't be. I'm not supposed to. I'm supposed to advise correctly. I hope I've answered you, sir.
Thank you. I think there was given an opportunity to go back. Does this go back to the drawing board? I think that.
Or give it an opportunity to advise government, or
engaging it on getting back to the drawing board so that at least your concerns can be raised. Or do you support such an idea?
I would support it with all my soul as an aviator.
Okay, there've been calls for a review. There've been calls for review from some of the witnesses that there's need to review the partnership agreement between ET and Zambia Airways, and I think that is what you are speaking to. And the salient issues that you've brought out probably would constitute part of what the review ought to look like, I want to suppose.
Yes, I put my whole soul in that.
Thank you. You have a brilliant soul. I'll ask the next set of, we'll take 3 questions. Honorable Samakai.
Mine is not a question, but I think just a comment in relation to what has been submitted. I think my view is that we gave it away on account of it being experienced. Because even in the previous submissions, we've been told they have taken most of the management positions. And I think this submission now tells it all, what we've lost in terms of managing this outfit. I think the cause for relations at the contract, I think that they should be supported. I thought I could make that comment.
Thank you, Honourable Member. Honourable, and then Honourable Nsanje will come last.
Thank you so much, witness, for elaborate presentation. Indeed, this is our country where we need to ensure that what we do is really beneficial to this country and, of course, the world. Now, I would like to acknowledge the fact that indeed, even in this committee, we are not privy to have critical information such as this agreement and the like, so that when we are deliberating, we should do full understanding of all these critical documents. The past few days that we have been sitting, I think for me, it's very difficult even to do certain recommendations because you are not privy to such critical information. Now, my question to you, Captain Emmanuel, would you think, going by the way things are, Zambia Airways, together with the Ethiopian partnership, would you think that Zambia, as a government, will have make profit from this deal, I submit?
Okay, from the current...
Maybe let me allow Honourable Musoi to please just take note of the 2 questions.
Okay.
Of course, Honourable Samakai's was a comment in agreeing with your submission. Honourable Nsanje.
Thank you so much for your input, passionate input, and the critical questions. I think you have dealt on the challenges. I've got 2 questions. One is to what opportunity do you see in this whole arrangement? And then 2 is what steps would you recommend for us to retrieve the situation so that we can bring about normalcy to this partnership with Ethiopian Airways and the operation of Zambia Airways? Thank you.
Okay, thanks very much. Sorry, maybe if you could just so that I don't make a mistake between the two questions. Maybe just a repeat of your
Yeah,
question.
the first one I said.
No, his question.
Oh.
My question is to do with profitability on the part of
Okay. Okay, I see.
going by with
Okay.
this arrangement.
Okay, yeah. Thanks very much. I was trying to be very attentive, and then somehow I lost my way. Okay. When I saw this expert support contract, it literally just threw me off my chair. It threw me out of my chair. I couldn't believe the things which were drafted in there. So this explains a lot about the other things that I've not seen. I've not looked at the lease agreement. I've not looked at the maintenance agreement. When you look at the lease agreement, you look at the maintenance agreement, and you look at what Zambia Airways is charged for these services, then I would have the information to compare with what the world market is supposed to be. So at the moment, the way I look at it, this is a very prohibitive situation for Zambia Airways. I don't think it's being objective in terms of the financial expectations. I would doubt if they're really getting to their business plan expectations with this kind of contracts that I'm seeing around. So I doubt. It's just that I do not have the other information. If I had seen the lease agreement and the training agreement and the maintenance agreement, then I can deduce. I don't need to be a financial expert. But I mean, I've headed operations before. I know how these things are done. You can actually just have a glance at the way the documents are arranged and contracts, and you know that this is actually a drain in the black hole. So for now, I'm very skeptic. And then going to the question by Honorable Munsanje, we already have an operation. We have recognized, maybe I have brought out certain things which I feel can be corrected. I think if you have willing people on the board, review some of just correct the situation, there is a possibility that we can correct. What is just required is the right type of representation on the people who are going to partake into these reviews. It's just like the example I gave on the theater in Kanchivia, and you are negotiating on behalf of a surgeon. Where is the surgeon? So I think questions like that.
Witness, thank you so much. And I think I was going to also address myself to that, that I think in terms of revisiting the partnership and the agreement itself, and in particular, is this 11.3 B, IDC is entitled to appoint 4 directors. I think it also has to be made very clear that the appointment shouldn't just be restricted, but that they must look at expertise from the industry. I think that would cure some of the varieties raised around the appointment of the board of directors, I want to believe.
Yes, that was my point exactly, Honorable Chair. I mean, if, in my own thinking, if there was somebody from the aviation, someone who has worked in the AOC sector, and somebody who has seen this type of agreement, like what I said on the expertise support contract, if there was somebody of that caliber, and then that document was floated to Zambia Airways, that person going through what I've gone through, he wouldn't have accepted this agreement to be entered into. He would have rejected, because he would have clearly understood that actually this has got very huge cost implications. This is a mother document according to my own assumptions. So anything else that comes after this document, it means it ties into this document. So those are the concerns which I was really trying to bring out on the selection of the board.
You said there is maintenance agreement and what other?
There is a lease agreement. I do not know whether it's an operating lease which they have, or a finance lease, or lease to purchase agreement. All this information is not availed to us. So I don't know what kind of lease agreement they have. I don't know what insurance is there. Let me just emphasize on this point of insurance. If I bring in an aircraft, which is already insured, it's insured according to my clauses. So if one of the clauses there says that for one to fly as captain, he must have 3,000 hours, he must have done what, you restrict that kind of insurance to suit your crew. Because where you are coming from, you have plenty of those aircraft and everyone else is flying those aircraft. So you'll be taking people from your homeland to come and fly here as captain. Why? Because your insurance excludes Zambians. It doesn't mean that we don't have. That type of aircraft is not a sophisticated, complicated aircraft, whatever has been purported about the Bombardier Q400. In my own view, it's just a modern turbopropeller engined aircraft. So what that means is all those Zambians who are rated on a turbopropeller can be trained to fly on that aircraft. Whoever is captain there, as long as you're flown, it doesn't have to be a Q400. It can be a Jetstream 32. It can be an Embraer 120. It can be an ATR. As long as you've flown that class of turbopropeller engine, it means you are qualified to fly as captain. But the operation has been going on, I don't know for how long there. I've only seen maybe one Zambian captain. They are all foreigners there. Does that mean that from UNIP 1967 when they
We need you on the mic. We need you on the mic.
Yeah.
Come on. Okay. So,
Because you are hitting it too much.
so my point was that from 1967 up to date, we used to fly into New York on a DC-10. It means we've got, yes, the industry has shrunk, but we still have people who fly turbopropeller aircraft. We still have people who fly jets. Some of them are, we've got a Captain Kaumbas who are in Qatar, flying 777s. Those people came from Zambia Airways. And we have fairly experienced people in the country here who've got similar ratings with what they have. Those people are qualified enough to operate on that aircraft. Who is supposed to put those people on those machines? It is the management. So who is managing it? Well, if somebody is managing at the interest of Zambians, he must ensure that Zambians excel. So that's a question that I'll leave here. Thank you very much.
Witness, thank you. Thank you so much. And I think you speak to the concerns, so many concerns raised by different stakeholders, so many concerns that I think a number of Zambians have been passionate about. Just hold on. And, you know, we are talking about issues around the business plan, which I think is also very important. It was raised by one of the witnesses who appeared on this particular panel on the need for Zambia Airways to make adjustments to the business plan, because a business plan by ET is a business plan that also saves ET's profit interests, you know, and we cannot be so naive to think that, oh no, you know, they love us, so that doing this business plan in our interests, etc. I think we need to be very open. I'm glad that you've also brought up the issue of local expertise. We have institutional memory from Zambia Airways, and people are scattered all over the world. What role do you see them playing in the new arrangement?
All those experts who are in the diaspora, they are Zambians. They are outside there, most of them, because they were trained by this government. And most of them want to come back home. want to come back. Most of the experts, if you ask them where do they want to work, everyone wants to come back home. Opportunity which has not been available. I list a number of pilots that I know and they can come and help this operation. They can do it. But what is clauses, sorry, which are in there? For the way they've actually structured this deal, the whole idea of a business is to make money. So you don't go into partnership for the sake of building capacity. You also, it is going into all these partnerships just to help Africa develop and put its footprint in aviation. What are they getting at the end of it all? They are getting something. Why? That's why you have their people working here as pilots. That's why you have their people working as maintenance engineers. That's why each time when the aircraft is due for what is known as an A check, sorry, it's in my submit, it has to be flown to Addis Ababa. These are things which can be done here. Before Zambia Airways was closed in 1994, they used to do maintenance there. Not for Zambia Airways only, but third party for other operators. Other airlines would come in, they have a problem, they would go to Zambia Airways maintenance hangar. That's how that company used to make a lot of money. Now that capacity, it's gone. Does that mean that we are incapable of doing it? No, we have people, we have the brains, and we have the expertise who can actually do that. That aircraft which is being operated by Zambia Airways now, for some of those checks which it is going for in Ethiopia, it's not supposed to be done there. The people who are setting up have ensured that that hangar is properly equipped and the people are properly trained to ensure that they can do some of these works here. Let me just put one submission here. Bombardier Q400, yes, it was leased from Ethiopia, Ethiopian Airlines. It is made in Canada by Bombardier, and the different parts of that aircraft are made by different manufacturers who are placed all over the world. So when it comes to engineer certification or anything, we are not just exclusive to go back to the person that we're in a deal with. That aircraft is made in Canada. It means there are other avenues of getting our own people qualified. And they could be even cost efficient. How many of those aircraft are flying around the world? There are plenty of them. How many authorized repair centers, how many training centers are available in the world? There are plenty of them. We can choose where to take our people according to the quality of pilots, according to the quality of engineers that we have. It's not exclusive to one city in Africa, no. Thank you very much.
Witness, I want to, on behalf of this committee, thank you for your deliberations, your input, your submissions to this committee. Be assured that we take these submissions very seriously, and as we work on our reports, your submissions will be taken on board. I mean, we'll ensure that we capture the core of these submissions, because we believe that they are pertinent and without any malice whatsoever. We submit this report, it has to be a watertight report, so that Zambia moves from where it is, Zambia always moves from where it is to where it must be, and that Zambia can also benefit as expected. So thank you so much, Witness.
Thank you very much, Chair.
And at this point, allow me to withdraw that immunity, but please continue enjoying the immunity that you have as a citizen of this great country conferred on you by the Constitution of the Republic of Zambia.
Thank you very much, Chair. 0969.
suffice to say we have met the quorum and we are ready to start. Dr. Mutemba and your team, you're welcome to the Committee on Health. It's your partner committee. We don't know how many times you'll be here, but from time to time you'll be required to appear before the committee. So the committee this time around, having just come back from that exercise of the supply chain, this time is dealing with the operations of the Zambia Flying Doctor Service. It's another issue which the committee felt that perhaps they should delve into because of its importance.
Recording in progress.
Because of its importance and the operational challenges that they are facing. So we just want to pick your thoughts as a major stakeholder. It's not our intention to keep you long. You have to go back and run our very important institution. My name is Dr. Kalila, a Member of Parliament for Ukulu, as well as chairperson of this committee. I'm with colleagues here who will introduce themselves, and then we shall also ask you to introduce yourself. And then we get underway thereafter. We may or may not ask questions. We are not public accounts. So I'll start from my immediate left.
Thank you, Chair. Good morning, our witness. My name is Monty Chinkuli, MP for Kanyama. Thank you.
Good morning, witness. I'm Honorable Mwene Luhamba, MP for Mangango constituency in Western Province. Thank you.
Good morning. My name is Chala Po, Area Member of Parliament for Chipiri constituency, Chipiri district, Wapora province. Thank you.
Morning, our witnesses. I'm Joseph S. Munsanje, Member of Parliament for Mbabara constituency in Choma. Yeah. Introduce yourself.
Good morning. I'm Wele Mija from the Office of the Clerk.
So over to you. Introductions first.
Thank you very much, Chair. My name is Mutemba Charles. I'm the Senior Medical Superintendent and I'm the presenter. And with me, I have a team that has accompanied me. They will be in their time introduce themselves.
My name is Doreen Shimalungwechiluva, Administrative Officer, UTH Adult.
Good morning. I'm Malekani Maxwell. I'm the Chief Purchasing and Supplies Officer.
Okay, so thank you very much, Tim. So UTH, I would like to draw your attention to a ritual practiced here to confer immunity upon all those that appear before these committees, just to protect you for what you say before this committee. In other words, no one can harass you or take you to any court of law for what you have presented in this committee. But there's caveat to that, as long as it is factual and verifiable. If it so happens that it's to the contrary, the law has sufficient safeguards again to bring action or sanctions for what you have said. However, I'm very confident, having appeared before these committees frequently and you're aware of this requirement, that it shall not be the case that you mislead the committee or the nation. So with that, you are now free to take us through your presentation which we received. You may wish to read it or speak to it. It's entirely up to the style that you choose. Thank you.
Thank you once again, and I'd like to express my gratitude to the services that we are receiving from members of parliament that assist and support the adult hospital. And we are also grateful to have an opportunity to share notes on something that we mutually have concern. Being the biggest and oldest hospital in the country, we have a strong relationship with Zambia Flying Doctors. So when we were requested to have an opinion on the Flying Doctor services, we thought maybe it was an opportunity also to express our concern and also give some suggestion as the way forward. In our deliberation, we consulted with our colleagues from the Zambia Medical Association. Also, we also consulted with the Zambia Medical, the Flying Doctor Service, as we were making a presentation. So now we try to summarize our presentation to avoid the duplication of something that they were also going to present, because they told us they also were coming forward. So when we shared notes, we found that there were a lot of similarities, but then we had to summarize and come with something that's concrete, and then maybe some contribution will not actually be verbal, which are not part of the written one that we have. I looked back at Zambia Flying Doctor Service, and I looked at an article that was 1965. It was an article in the British newspaper, Reuters, 1965, where they were making announcements about setting up Zambia Flying Doctors in Zambia. So this service has gone back to service the rural areas as back as 1965. So it's a service that has really moved times and everything like that, yeah. But as we're looking today's time, Zambia has changed, and the rural areas are not the same they used to be in the past. And the type of patients that we are dealing are not the same. So the demand from the public has changed, and we are much more accountable now. Yes. So from my observation is that Zambia Flying Doctors has not so much moved with the time. That's my general observation. So in terms of comments, I'll refer to the document that we presented to you, where we looked at the strength and the weaknesses, and also some of the recommendations that we looked as we interacted with the colleagues. Yes. Yeah. First and foremost, we have to acknowledge that the Zambia Flying Doctor Services is cardinal and very, very important, and actually should be supported and maybe expanded. What we're going to discuss are some of the challenges that we have seen, and also how we can, as a hospital who has been interacting with them for a long period of time, how can we maybe move forward with them? Yeah. So one thing that we have looked at, if you look at Zambia Flying Doctors in terms of strength, yeah. One thing that we noticed is that it's easy to access patients in the remote areas, especially in today's time when it's so much raining. Most of the roads are impassable for our ambulances and everything like that. So they only, apart from Zambian Flying Services, there's no other access like that, yeah. So in this case, they play a very big role, yeah. Now, and also apart from that, they help us also facilitate movement of patients in very, very quickly, yeah, in a very timely manner, yes. And then they also, what we have said, that maybe ZAF has given them the authority to fly at all times of hours without so much permission, because sometimes we have access at awkward times. So this is something that we have appreciated very much. But also we have noticed some weaknesses when it comes to Zambia Flying Doctors. Yeah. Now, one thing that we have is that it's not so much professionalism. It operates more like just a form of transport. The patient is taken to the airport, and they pick the patient and drops to the next airport, and their job is done. And I thought they could do more. Yeah. Let me just give an example. Like today, last night, we received a patient from Nakonde. The patient was involved in a road traffic accident, head injury. Until this morning, we had no idea that this patient is coming. And when the patient came this morning, when the doctors examined the patient, the doctors decided that this patient is stable to go back. Now, this is a patient who has come all the way from Nakonde, used so much fuel, and landed at UTH. When the doctors in the morning to say that, no, this patient can go back. So that type of communication, just involved in picking up a patient from the airport and dropping to the airport.
Sorry, was he the patient brought by Zambia Flying Doctor Service?
Yes. Yeah. But we're concerned to say that, look, so much resources has been spent. Yeah.
Why didn't they take the patient?
Or at least communicate with us prior of the system of communication to the receiving unit. So the receiving unit, in a timely way, they will know the patient that is coming. So they can also be ready and also advise that maybe it's not necessary for this patient to come. That's number one. Number two is this way. The other weakness that you have seen on board, because sometimes there are some critical patients. There should be professionals like nurses and doctors who are able to manage and stabilize the patient. Because when they are flying a patient from the clinic, from the hospital first, which is referring, one can assume that this patient, they have challenges managing this patient. And this patient cannot continue waiting somewhere. So they want to fly him to a bigger facility. So, and as long as the patient is in that facility, they are still managing him, stabilizing him. Now, when the patient enters the airport, the airfield, enters the plane, one could assume that there are professional people there, well equipped, to continue managing the patient until they hand over to the next facilities. But that's not what happens. As I said earlier on, they pick the patient from the airport, drop them to the other airport, and their job is done. One could assume that they are involved actually picking that patient from the facility, medical facilities, because they have the skill and the equipment also, and continue managing that patient as they are moving around, moving on airfield until they drop the patient and hand over to fellow professionals like that, and wait for feedback when that patient is stable. Example I've given you is that that's not what's happening. And now, for us now, we are stuck with that patient because now transport has to be found to take the patient back. Yes, Nakonde. And that's going to be a challenge. Yeah. So those are some of the things that we have seen that they need to be looked at. Because those are practical ones. Yes.
In the case of the Nakonde patient, who made the decision that he should be brought to a higher facility?
Usually what happens is that most cases in the hospitals there and clinics and everything, not every time there are doctors there. They are sometimes run by clinical officers and licensed officers like that. Yeah. So now when the patient cannot be managed there, they will make a decision to say, let's fly. Yeah, and they have easily access. If, for example, Zambia flying doctors will pay attention to the rural areas than for another patient in the urban areas. So most cases they can say they have this particular patient. Now, because of the issue of professionalism, they're not able to interrogate the people at the facilities. What case is this, so that they can also have a judgment? Is it really necessary to pick that patient there and fly to Lusaka? Yeah, where the doctor will just say within a few period of time, well, no, this patient is stable. Can the patient go back? Yeah. One will assume that if there was an input from us, yeah, would be, yeah. So then it comes to modernization. Yeah. As we are seeing today, medicine has modernized. Yeah. One could assume that Zambian flying doctors could have physical presence in the facilities where they usually send patients. For example, at UTH, we can have a representative of flying doctor service. That can be a link between us and them, so that we can coordinate as they are referring patients from these facilities. We can have an input. That's number one. Number two, also, we know that it's expensive to maintain the fleet and manage patients, flying patients like that here. So now we have national insurance. Some members are members of national insurance. Yeah. If it's possible that national insurance, the benefit package can also accommodate registering people to use the flying services. We are doing kidney transplant at UTH, and we have managed to convince the national insurance NEMA to register patients so that they can fund the transplant. Yeah, at a cost of about $14,000, and the NEMA has agreed. So I think they can also, if it's brought to their attention, to register the flying doctor service, so that patients who are in the remote areas, yeah, who can qualify under national insurance, can also access services like this. Yeah. The other thing that I noticed that is also need modernization is, there's something we call telemedicine. Telemedicine.
Yes.
It can improve in terms of communication in the remote areas. And the Zambia flying doctors can be at the forefront of trying to bring about telemedicine, so that doctors in the facilities who have limited resources, but at least they can have a visual communication with the doctors at the facility where they will end up sending that patient, so that we can coordinate and say that, no, this patient can be managed this way, or on flight this way, they can be managed this way. That way, to me, it will be of benefit, because if they have the command center where there's somebody coordinating what's happening in, for example, Nakonde, we would know that this particular patient may not necessarily need to come to UTH, or maybe it's risky for them to fly, because sometimes there's also risky to fly patients with head injury because of biometric issues, pressure changes, and everything like that. Yeah, yeah. So sometimes we have more resources to advise our colleagues at the site. So I think if telemedicine, national insurance, and also professionalism, so that the patients are being managed while they are also on board. Yes, and also they need to have physical presence at the facilities where they are sending patients much more often. Yeah, and also they should be also involved in picking up patients from the facilities, not just from the airport. So they are involved from managing a patient from that facilities, also continue managing that patient on board until they hand over that patient to the final destination, and also wait for feedback to say what happened to that particular patient, so that there's also an opportunity for learning and doing better next time. Yeah, I'm very passionate about flying doctor service. I could have continued on and on and on. Yes, yeah. Probably I can.
Did you work there?
No, in my training, I've trained, like when I did my nephrology training in Germany, during winter. also there are challenges also of road network. So they use the air ambulances. So sometimes from time to time you are also asked to follow. So there's a system that you have put in place that help, yes.
Okay.
Yes. Thank you. Just some feedback from members.
Yeah. So the two members of your team don't wish to chip in, or will chip in at the time of questions?
You can chip in later. We'll answer some questions.
Okay. Yeah, so honorable members, that's a presentation from the University Teaching Hospital. And at this point, I would like to invite members of parliament to seek clarifications or ask questions. Honorable members.
Yes. Doc, you have explained very, very well. But when I look at your submission, it's not detailed. Those are some of the ideas that were asked for you to put in here. Because what you have said a lot, very, very important points. And I don't know whether we are going to remember them, because they are not in your presentation. So we wanted you to put such kind of comments, ideas, how best we can deal with this issue. I thank you.
That's a comment rather than a question, that perhaps those very valid points and ideas should have been included in the submission. So I believe the UTH team has taken note. Honorable Msanje.
Yeah, thank you so much, Chair. Doc, you have made a very wonderful, wonderful presentation. I would like to embrace the issue of telemedicine for the Zambia Flying Doctor Service. Actually, I'm surprised to learn about the lack of on-board management of the patients, because I believe that should be a very critical aspect of their service, that they should be able to provide an ambulance service, for these kind of activities. So that's something we definitely have to attend to, I think, Chair, as a matter of emergency, because that needs to be addressed.
Yeah, we'll bring it to the attention of they will be here.
Yeah, and now the issue of telemedicine, could you just expand how we could embrace this aspect of medicine for the Zambia Flying Doctor Service? I'm of course privy to some of the ideas, but it would be good to also get it from experts and the gurus like yourself to hear more in that direction. Yeah, so that I can have clarity of thought. Yeah.
Thank you very, very much. If I look at, I also went ahead and looked at the Act of the Zambia Flying Doctors. When it comes to the powers of the board, on number 7, 7C, it also talks about setting up clinics. So I think it's consistent with something like that would be like telemedicine. Yes, so that you have physical presence and visual presence, and also interact with the local team. Yeah. At UTH, we have what we call digital institute by the telemedicine institute that we have of COVID of patients. And we noticed that we had a lot of doctors with limited resources and skill, but very dedicated. And we were stuck with a lot of patients that they didn't know what to do about it. And then movement of doctors from one place to another because of restriction of COVID was a challenge. So we came up with this digital big institute, which is that we also beyond Zambia. Yes. So now we look at Zambia Flying Doctors, they have the capacity of movement from one area like that, and I think the ZAF has given them unrestricted movement powers like that. So now one thing that they are, I think, not so much making use. I'm not sure that the members of the board, whether this something that they have thought about it or not, but I thought in today's time we can't do without it. Yeah, since they have access to where we cannot have access. They are seeing challenges that we cannot see. But we have the skills and the personnel and the relatively more equipment And we believe that through interaction with the colleagues that have limited resources, we can able to give them confidence, first and foremost, in how to manage patients in their facilities without necessarily need movement. And I know that Zambian flying doctors may not be available everywhere at every time. So where they're not available at every time or waiting or being delayed, because I don't know how many flights planes that they have. So probably, yeah. So now looking at like this rain season now, there is a flood here like that, and they want to move a patient this side, there. So where they're not able to reach, but they can reach with knowledge and skill digitally, yeah, which is very easy to do. Yeah, so for me, that's what, there are more details that we can do, but we have the platform at the hospital to provide this service. Thank you.
Thank you so much, Chair, and thank you for your presentation. I want to look at Zambia Flying Doctor Services as an entity that supplements on the lacunas that may arise due to distant places. And if you look at the unity, is operating on a grant that may or may not come. And there are quite a number of non-state stakeholders that, for me, it's like it's an NGO that is just trying to help the bigger institution like yours. So coming up with such comments as operates like transporters with no human, I feel it does not sit well, because one, if someone is trying to help you, I think you, the recipient, I think you should play a major role, considering that that unit does not, at times they go unpaid. So this entity that is trying to supplement or help or look at your your field, what is it as an entity that is being supplemented would advise either the government to do, so that those that entity will be able to help you in the manner that you need to be helped, like the example that you have just given. If probably there are suggestions that you send in, qualified doctors, that patient who was, brought here would have been, certified along the way that, no, this person actually he's fine, and maybe the plane upon landing, they will turn. So it's like, for me, there's no proper correlation between those that are being helped and the helper. I don't know if you've got my concerns well.
Thank you very, very much for the comments, and the comments are valid. Yeah, and our role is to observe what is happening and look at the history of Zambia flying doctors, and looking at the time that we are living in, that things have changed. Yeah, and as you are saying that, yeah, the challenge of funding is everywhere, even at where I'm coming from, funding is a challenge. And how can we come up with suggestion how to improve the funding and the efficiency of Zambia flying doctors service? Yeah. So one of the way we can improve the funding is to also register with the national insurance. Yeah. Can also supplement the efforts of government by having more of their members. They're saying that they charge a small fee. They may not even need to charge. The national insurance can be paying them because they are providing services for their members. That's one way. Two is that the improve of communication. They will know which patients that they can also interrogate the facilities where they're receiving the patient from, to say we are also professional. They can say that a case like this can be managed, maybe not at Indola, maybe it can be managed here and here. So that form of interaction can help improve. It's not a criticism, it's an observation. And apart from that, they are all serving the same patients. Yeah. Thank you.
Okay, so Dr. Muntemba, maybe, and let us all accept the fact that the Zambia Flying Doctor Service is a government institution. Okay, it's part of our healthcare delivery system. In fact, it is even much better off than UTH, in the sense that it is even set up by an act of Parliament. You see, I think the Health Services Bill or whatever was repealed, and currently you are just sitting like that, right? Yeah, but for them, they are set up by an act of Parliament way back, 1960-something, I think amended somewhere around 72. So they are very much government-owned and meant as part of the healthcare system of this country. Even though over the years they've been forgotten or neglected, maybe that's the right word to use in terms of their operations, which is why we are doing this exercise to try and find out, first of all, are they still valid? Are they still necessary to continue? Do we still need that kind of service? And so far, everybody seems to say they are as valid as they were at the time the idea came as it is today. So meaning it's not in dispute, it's agreed. Except that, of course, they have stagnated and times have changed, which is the point that you are making, and that there is need to bring in various other innovations in order to fit patient outcomes as we desire. So the starting point, which I want to ask, is just over the basics. What was the reason for which they were originally set up? How would you answer that?
So initially, when you look at history about it, was to access the remotest areas of Zambia, where there were impassable roads, where, yes, not only limited professional personnel, but not accessible. Yes, and the British government came up with this concept. And you look about, they looked at what's happening in Nigeria and Zambia, and they gave Zambia as a good example, where they were setting up airfields in remote areas, where they can fly to other clinics and people provide services. Yes, but the so-called remote areas now, they are different now. We have schools, we have hospitals, we have doctors, and other things like that, yes. Yeah, so the concept, again, has changed. Yes. Oh, yes, we need them. We need them, yes. More than ever. But not in their way they were, because they are, as you said, they have stagnated. And the modern medicine can come and say that, no, the concept of medicine today is this way. And if they are going to meet the challenges of today, they cannot work the way they used to be working in the past. Yes.
We have read that they've been operating recently in other areas, such as in Chongwe here, Kanakantampa, Rufunsa, Mvongwe, Mwekera. How do you look at that?
So that one now depends on hierarchy of authorization to use the plane. What's the channel? Yes, when they receive a request, how do you process them? So the criteria, who qualifies to use the services, that's where now it needs to be fine-tuned. The concept was remote areas where there is not accessible and something like that, yes. Yeah. At what level? Not everybody can qualify. Not everybody can call upon Zambia Flying Doctors. No, I need this person to go there. Yes. So there have been abuse of the system. Yes. Yeah. So, yeah.
Find out whether it is within the mandate for them now to begin to operate in accessible areas. Kanakantapa is, you can basically do your outreach there. Mongwe, Mwekera, according to what we intend, not be duplicating what you colleagues are doing.
Yeah. So remotest areas with yeah, could be flooded, like that. Possibly they are modernized of the criteria. Who qualifies to use the services is something well defined and avoid abuse.
Yeah, lastly, or maybe there could be somebody else. They are based in dollar. So, example you have given us, who was suspected to be a and they brought the patient all the way from Nakonde to UTH. Why did they not take to the northern part of the country, which is shorter and cheaper? Are there no skills that side?
Yeah, that one is difficult to answer, but it comes to the same form of system of communication. Communication to say that they have been called upon and they have the skills and knowledge to actually interrogate the call to say that you are being called to provide a service to this place. They can actually question whether it's necessary to go there, and if it's necessary to go there, where is the best place in Zambia to provide a service for that unique patient. Then, yeah, but it's like now again it comes to the issue of transport. They're just like a form of transport. We want you to move one person to this place and they move the person. But if they were involved to say that we are the ones who will be managing the patient from that facility and on board the plane until we drop that person at that facility. But then since they just pick from the airport to the other airport and their work is done. And as long as that continues, this misunderstanding will always be there and it will be costly.
So who picked the patient from
This
Zaf?
Zaf, yeah.
Here?
Yes, Zaf, yes, yeah.
And then who brought the patient?
Now we have to look for transport to pick the patient from that.
They communicated, they got in touch.
Finally, they got in touch with us. Because the idea is supposed to be the facility, first and foremost, the hospital where this patient is supposed to communicate with us.
And when you arrived there, was the patient escorted by a health professional or was just with the relatives?
I don't think there was a health personnel. And the patient was actually stable patient, yeah. Yes. Patient probably because he just come and within 24 hours you are said that you are okay, can you go back? Now we are stuck with you because transport to Nakonde will be a challenge.
You call them back. Yeah. Do you have Vice Chair?
Are you going to do better than this one?
Yes. They were making the report, we had a bigger report. But when the team went now to interact with Zambia Flying Doctors, they noticed a lot of duplication. Yeah, they summarized, but
they may need to be reminded by chipping in some of those points which you mentioned just to keep it alive. So I noticed, Doc, you have concentrated more on the things, maybe the actual operations of the serviceability of the that. Yeah, I think I don't see any other question. At this juncture, I would like to withdraw immunity, Doc, and then wish you well as you stand down to take up important tasks.
we had to produce for this nation that flag to demonstrate the meaning of what we were as a nation. And we explained exactly what that flag stood for. So it was an extremely important flag. The importance of that flag at that time is exactly what it is today. And it's important that those who are teachers, who are whatever, are able to impart some knowledge to young people, they ought to use the importance of that flag. Its meaning. Whatever level of schools they are at, they must remember the importance of our flag, national flag. Is key to the future of Zambia. It's time for us to really thank God, first of all, our Creator, who has guided us in this wonderful way. It's time for us to look across the nation and see how different people from different tribes have stood together. They have stood together, children of one Creator, God our Creator. 1964, up to now, we're one Zambia, one nation. We're strong. We're standing together. There's no reason for us to begin pointing fingers, I'm this tribe, I'm that tribe. No. We are all God's children. God's children, teaching. As we become a Christian nation, we're following what Christ taught. We are all one.
Mother of Millions Foundation. You are very much welcome to the Committee on Youth, Sport and Child Matters. The main role of this committee is to look into issues affecting the children, also young people with issues to do with sports. And we also provide checks and balances to the executive. You know, there are three wings of government in this country. The way we are going to proceed, first, members will introduce themselves. Then you are going to introduce yourselves, the secretariat. Then I'll guide how we are going to further proceed with our interactive meeting. Let's begin with introductions. We'll begin with left honorable.
Thank you, Chair, and good morning, everyone. My name is George Kasavira Kandafula, Member of Parliament for Serenje Central.